And straight to that breaking news on this Friday night. The United States is lifting the pause on the single-dose Johnson & Johnson COVID vaccine just hours after a panel of health advisors said the benefits of the shot outweigh the risk. Thanks for being with us tonight on NewsNation Prime. I'm Rob Nelson.
And I'm Ashley Ketz, in for Marnie Hughes. This move comes after federal health officials halted the Johnson & Johnson shot so they can investigate the small number of causes or cases of these rare but serious blood clots linked to the vaccine. So far, nearly 8 million people had been given the shots. 15 of them, all of them women, developed a highly unusual blood clot. In 3 cases, those clots were deadly. Tonight, the U.S. says shots can resume with an added warning about the risk. NewsNation White House correspondent Allison Harris is live in Washington, D.C. with the story tonight. Allison.
Rob and Ashley, the CDC director just finished speaking about this. The only single-dose vaccine is back in the U.S. The CDC and FDA lifted their 10-day pause on the vaccine within the past hour following an investigation and hours of discussion and debate today by a panel of CDC advisors. Those advisors recommending use of the Johnson & Johnson vaccine resuming. The FDA will provide a fact sheet to the people who are getting the J&J vaccine, telling women 50 and under that they are at a greater risk of developing rare blood clots from the vaccine. The CDC also releasing new information tonight about what they found looking into this. We know that there are a total of 15 cases of these rare blood clots linked to this vaccine. If you'll remember, on April 15th, there were just 6 of those cases. Among those 15, there have been 3 deaths and 7 people hospitalized, including 4 who remain in intensive care tonight. The average age of the women affected is 37. It's affecting women ages 18 to 59. The risk of those rare blood clots remains very low, according to the CDC, still about 1 in a million, a little bit greater than that. The head of the CDC says the reason that federal agencies ultimately decided to bring J&J back on the market is because the benefits outweigh the risks. And that's what those advisors were discussing for hours today, saying that the vaccine could prevent thousands of hospitalizations and hundreds of deaths.
The American public should feel reassured about the safety systems and protocols that we have in place around the COVID-19 vaccines. Our systems help to identify incredibly rare events. We at the CDC and FDA took the time needed to fully investigate this issue. We paused use of the vaccine out of an abundance of caution.
This vaccine can return immediately. Shots are expected to resume as early as tomorrow morning. This is especially important for rural areas and underserved communities that have been using the Johnson & Johnson vaccine because it's so convenient, because it is only 1 dose. The CDC is now working with some of those sites across the country to get those fact sheets out to them and help get the Johnson & Johnson vaccine back online. In Washington, Allison Harris, NewsNation.
And Johnson & Johnson did release a statement tonight saying in part this recommendation is an essential step toward continuing urgently needed vaccinations in a safe way for millions of people in the U.S. And it goes on to say the company remains committed to the health and safety of people worldwide. And joining us now tonight to talk more about this is Dr. David Wall. He is a professor of infectious diseases with UNC Health. And Dr. Wall, thank you for coming on tonight.
Thank you for having me.
Well, first off, I want to get your reaction to the news today that this once again has the green light to resume here in the U.S.
Yeah, it's what we expected. The Johnson & Johnson vaccine, as was reported by Allison Harris, is a safe vaccine. It's very effective, and it's saved thousands of lives. So we're glad it's back. I really do agree with Dr. Walensky that the system's working in detecting any problem. And we found there's a rare event that is occurring with this vaccine. And I think measures are being taken to inform the public about that.
And one of those measures now is a warning label explaining the risk. And Allison talked about the fact sheet. I have it right here. And on page 3, it talks about these blood clots and how rare they are. We know they were in women, and we know all but 2 of them were in that 18 to 49 age group range. So do you think this warning is specific enough? And can you explain it to women who maybe aren't going to read this warning and want to get the vaccine?
Right. I think the warning sheet is helpful. It's a fact sheet that tells about the vaccine. There's one for every single vaccine that's out there. But I do think that we have to do more. And I think the messaging that we're doing right now and that we'll do in our clinics is going to be important. And providers have to counsel their patients about the risks and benefits of the vaccine. Clearly, the benefits of the vaccine really do outweigh these very rare events. We're in the middle of a pandemic. Over 600,000 people have died. It's surging in different parts of the country. We need to get more people vaccinated as variants spread. So I think we've done the right thing. We paused, we investigated this. We know the magnitude of the problem. Women and men have to make decisions with their providers about what's the best vaccine for them, given their risks.
And if someone is still concerned, we know vaccine hesitancy is out there. What would you say to them, whether it's this shot or the other two out there? What would be your advice?
So I think it's really important to differentiate this from the other two vaccines, the Moderna and Pfizer vaccine. Many more people have gotten those two vaccines, and there's been no signal at all of any problem. For the J&J vaccine, as was mentioned, there's benefits of this vaccine. A single shot, you don't have to return for a second shot. Its cold storage is a little bit more convenient. So there's people who really do want the J&J vaccine. And again, the vast, vast, vast majority of them will have no problem with this vaccine. If you're worried about it, you're a woman, you worry about clotting, I understand that. And again, you may decide the Pfizer or Moderna vaccine is for me. Again, lots of different things have risks. Birth control pills have risks. They cause more clotting than what we're seeing with the J&J vaccine. People have to make decisions every day about what's right for them, given their risks and benefits.
Dr. Wall, we appreciate your time. Thanks for weighing in on this big story today.
Thank you.